Hey, it's Galia. I wanted to really quickly talk about esophageal cancer. Esophageal cancer mostly comes in adenocarcinomas, but it also can come in other types. Let's talk about the risk factors. The biggest risk factor is smoking. It actually increases your risk by a twofold, by a twofold. Okay, so smoking is definitely one of the highest risk factors. And then Barrett's esophagus, excessive alcohol intake, obesity, and when when you have destroyed mucosa. So, for example, um, people who work in like construction, they have a lot of inhaling of cement. So that can destroy the mucosa, which puts you at risk for esophageal cancer, which makes sense, right? Because if you have less mucosa, then there's less protecting. And then achalasia is basically delayed emptying of the lower esophagus, and that can cause squamous cell carcinoma, which is also a type of esophageal cancer. Most tumors occur in the middle and the lower part of the esophagus. And It usually starts out as like an ulcerated lesion. Um, and then it can penetrate the muscle and leave the esophagus, which is what we call metastasis. The most common places for it to go to is the lungs and the liver. So we need to like really remember that we need to definitely go to the doctor if we feel what I'm gonna say now. So the clinical manifestations, dysphagia, progressive dysphagia. So it starts with not being able to swallow meat very well, and then it goes to soft foods, and then it goes to liquids even. And so the dysphagia is a huge common huge and common clinical manifestation. Um, Also pain, but that usually indicates late stage esophageal cancer. You can have pain in your substernal area, epigastric, and back area, and it's usually increased with swallowing. So I want you to take a big swallow from me, right? So usually it doesn't hurt that bad when you swallow, okay? But for people in with esophageal cancer, it's very painful to swallow. And this pain can radiate to the ears, the jaw, the shoulders, and the neck. So let's talk about how I said that most of the tumors occur in the middle and lower esophagus, right? The tumors that occur in the upper esophagus can cause sore throat, hoarseness, and choking, which is really dangerous. You need to make sure, for nursing especially, that you have an airway intact. Make sure to sit them up. When the narrowing is very, very severe, people can regurgitate blood contents, and we see this as bright red blood. This is what we would say for esophageal cancer. And then a hemorrhage, the last one, is a tumor that breaks through the esophagus and goes through the aorta. And as you know, the aorta is the blood supply to the rest of the body. So it like bursts. And that's what a hemorrhage is excessive bleeding, basically. So to diagnose this, we would need an endoscopy. We would stage it and biopsy it with this endoscopy. And also we could use a barium swallow to see see how the liquid is going down. And you can also see the narrowing of the tumor, the narrowing that the tumor has made throughout that study. So it's really interesting. You could look it up on YouTube. So then let's talk about surgical interventions. So surgical interventions. First, we definitely want to remove part of the esophagus. But there's different ways to get that part of the esophagus. I wouldn't back, in a way. So we could use a Dacron graft, I think it's called, and that is to repair the part of the esophagus that we took out. Or we could do the anastomosis of the resected esophagus to the stomach. So we could attach that, or we could attach it to the colon. And we have to remind patients that once they get out of surgery, they're usually going to have an NG tube, and to not be surprised if there is some bloody discharge for about 8 to 12 hours. And then the next thing we can do is photodynamic therapy, which is really, really cool, in my opinion. So basically, we give the patient IV porphyrin sodium, which is a photosensitizer. And the surgeon goes in with a light to where the cancer is. And the light essentially works with this photosensitizer, and it destroys the cancer cells, which is really, really cool. But you have to know that the patient should not go in direct sunlight for up to 4 weeks. So endoscopic mucosal resection is when it's for very early stage cancers, and then radiofrequency ablation is used to kill cells that through electric currents. And then dilation, basically, what it sounds like, it can remove obstruction. So we can put a stent in sometimes if the dilation doesn't work, and that basically lets the food and water flow through. And radiation and chemo, which we're very familiar with when it comes to cancer, this can help with dysphagia, which again is trouble swallowing, and it also can increase survival. Okay, so targeted therapy. So for esophageal cancers, they have HER2 proteins on the cells, and HER2 basically encourages cancer cells to grow. So if we block the HER2 cells, the receptors, then we are basically making sure that the cancer doesn't grow more. So that's HER2, and the medicine for that is trastuzumab. And I do not think I pronounced that right, so don't call me out on it. Well, you can if you want, but tell me how to pronounce it if you know. And then the next one is an angiogenesis inhibitor, which usually binds to the vascular endothelial growth factor, which is VEGF, and it kind of says stop to the blood vessels, so that the cancer does not grow from there. And because, as we know, cancer is an abnormal growth, so if we do this, then it could stop the cancer from growing. And this is only for cancers that start at the gastroesophageal junction, which is the basically the middle or in between the stomach and the esophagus. And that medicine is called ramucirumab. So MAB is the ending for targeted therapy. And then nutrition. A lot of times we give parenteral fluids after esophageal cancer, esophageal surgery, and possibly a feeding tube. So we got to warn the patients, and the patients must have a lot of anxiety due to prognosis or due to any kind of, worry about their condition. And we need to have them have a swallow study before we give them anything by mouth, so food, liquids, whatever, and start at 30 to 60 milliliters every hour, and then you can work your way up eventually to small, frequent, bland meals. And we have to remember that since they just had the esophageal surgery, we have to watch out for leakage into the mediastinum. So what are ways that you would see leakage? You would what are ways you could tell that there is leakage in the mediastinum? Right? Okay, perfect. So you're doing great. The top 3 ways are, I feel like I'm on a game show, the top 3 ways. Pain, increased temperature, and dyspnea, which is like shortness of breath. And we need to make sure that these patients with esophageal cancer are have a high calorie and high protein diet, and a lot of the times this high calorie and high protein diet, it's eaten in small frequent amounts. And we need to maintain the upright position for them for about 2 hours after eating. So some nursing diagnoses you can think about is chronic pain related to compression of tumor on surrounding tissues, or chronic pain related to esophageal stenosis. We could also say imbalanced nutrition related to adenophagia. Does anyone know what that is? Great. Yeah. So it's trouble. So it's not trouble swallowing, but it's the painful swallowing. Okay. And then dysphagia we talked about. Or chemo and radiation could put us at risk for imbalanced nutrition. And then risk for aspiration is definitely a big one. And that would be related to difficulty swallowing. And then anxiety related to the prognosis is also another one. So which out of these 4 would you say is the, according to Maslow's hierarchy of needs, is the most, I wouldn't say important because all of them are important, but the most critical? Right, so the risk for aspiration is the most critical because, in my opinion, that because we're looking at ABCs first, and aspiration, you can stop breathing if you aspirate. So that would definitely be important. And I think I would also do imbalanced nutrition because that can go downhill quickly. So yeah, thanks for watching the video. If you have any questions, let me know.